Now with a story on the latest information on hysterectomies. Here's our reporter, Laura Windsor.
Once a woman is told she has to undergo a hysterectomy, it's important for her to know all the facts about her impending surgery. We spoke with Dr. Lance Betson of St. Jude Medical Center in Fullerton to find out the latest information on hysterectomies.
Hysterectomy is when you remove the uterus and possibly remove the ovaries and tubes at the same time. And usually the primary reason for people to have this removed is that they're having abnormal bleeding, whether it's a change in their cycles or whether it's heavier bleeding with clots. That's become to the point that it's more troublesome for them, and that's usually the primary indication. Other indications could be whether it was chronic pain, endometriosis, or other things that they've been diagnosed with. Fibroids is another very common indication for it to be removed. Having a hysterectomy is still one of the most common surgeries that is done in the United States each year, with over 600,000 being performed. The statistic is that anywhere from 1 in 3 by the time they're 60 years old will have a hysterectomy, usually for the bleeding as a primary cause, though. There are a number of different routes for doing the surgery. The most common, about 75% of them, is actually done through an abdominal incision. We're seeing now more as there's a shift towards minimally invasive surgery and quicker recovery times. More of these procedures are either done in a vaginal route, or whether it's using laparoscopic assisted techniques, using small cameras and instruments with small incisions in the abdomen to assist doing some of the work from above and then doing the rest of the surgery either down below. What we're doing now is that there's more alternatives to actually having a hysterectomy, which is the best thing of all, is for patients that have had this abnormal bleeding, some of the endometrial ablation techniques or the diagnostic techniques, looking with a camera into the uterus itself and specifically finding the areas that are abnormal and taking care of those itself, they may not need a hysterectomy. Another type of hysterectomy that is becoming a little more popular now is not only is laparoscopically assisted, but some people are choosing to retain the cervix as part of the surgery, with some beliefs that it may help with sense of well-being and possible sexual function, although the studies have shown that that necessarily isn't the case and that there are other complications with still needing to have your pap smears done yearly and possible continued some bleeding and spotting. Some people are electing to do that procedure, and it's becoming more popular. For fibroids, which is, again, a main indication for people to have a hysterectomy, there is a new machine on the horizon that actually can use ultrasound guided and actually will help to shrink the tumors. There are some radiologic studies that are done where they actually go in and try to block the blood supply to the fibroids and cause them to die and shrink the problem and hopefully decrease their problem for bleeding. So again, we're looking for, again, less invasive procedures and quicker recovery time is the primary goal here. The surgical team that we have here at St. Jude Medical Center has been excellent. We usually have a dedicated team for each room, and they know what we need, and they're always very attentive to make sure that we're well taken care of. But more importantly, that the patients really come through and they always will tell us afterwards that they really had a great experience, as any hospital stay can be. From being checked into the initial check-in point to when they finally get discharged at home, the care has been always excellent.
Knowing your options can help you work with your doctor for the best treatments. For the American Health Journal, I'm Laura Windsor.